was modern history and music. I have a degree in music from the
music.
I was a classically trained musician.
Oh, great.
And then I did my my initial training in Chinese medicine in Boston, and then my doctoral degree, clinical doctorate in Oregon in Chinese medicine.
Okay.
And so my clinic is in New Jersey, and I teach in New York City in one of the big Chinese medicine schools. I'm in Beijing and Nanjing teacher.
That's great.
Yeah.
Okay, so you both from the America, and also you also had already got a doctorate degree already.
Yeah.
So that's quite a unique area. You got a Chinese medicine doctor, but now you join another doctorate degree. What's your understanding?
Well, the difference is that in the United States they're all clinical doctorates.
Oh,
so
that means not so much lectures.
It's not a PhD, it's a clinical doctorate.
Oh, okay.
So there's actually a lot more coursework. There's a lot more coursework, but there's not as much independent research.
Oh, I
so
see.
that's the big difference.
Oh, I see. I understand. Okay.
Yeah.
Okay. Thank you. Yes, Dr. Mark.
In 1986, after my uni studies, I worked in hospital for 12 years in different departments, acupuncture, elderly people illness, and stroke and neurology department in the hospital for 12 years. 1998, just 1 year before Tianjun, I studied master acupuncture and trainer department in Nanjing University. 2001, I finished the training and worked in the Hangzhou, that's called Red Cross Hospital there for about half a year. They now resigned to come to the UK. In 2002, at the beginning I worked for Shizhen company, which is the Shulan's previous company there. So I built my own clinic in 2007, so until now in Newcastle area. So and also I teaching pediatric massage and acupuncture and CPD, the clinical progress development in Poland and in my clinic.
Great. Thank you, Dr. Mark. Yes, please.
I'm Marja van der Schild. I'm from Holland.
Yeah,
I started with the X-ray therapist, and then 25 years ago I started with the acupuncture education.
Oh, 25 years ago?
Yes.
Oh,
I just had my anniversary for 25 years practice. And then I did also my master, and I did herbs, and now I have my own practice in acupuncture, herbs, and also orthomolecular therapist. That's some other part. And for 10 years I am in the organization of the TCM in Holland, Zong, and I'm the vice president of that.
Vice president?
Yes.
Vice president with Professor Wei Xiang?
Yes,
yeah,
Professor Wei Xiang.
Great.
Yes.
Welcome. Thank you.
Thank you.
Okay, I think that's all. Yeah. Okay, thank you very much for all your colorful introduction. It is quite so colorful. First of all, from so many, I think 5 or 6 different legends. Countries in our small group, in our small room, so many different countries, and also so variable different background. Some purely Chinese medicine, some with Western medicine physician, some with even business, music, the essential, and the X-ray, different background. So this is quite colorful. Different background are my understanding. Although some of you are possibly slightly later than some of us to involve the acupuncture Chinese medicine area. But your background, I personally believe, are all contribute for your career development. Whatever business management, whatever music, etc., they are all very good contributor for your learning, particularly now this kind of the postgraduate training, this program. In terms of this postgraduate program, of course, definitely not like our just bachelor degree. Mostly lecture talking, most of my lecture talk. But my understanding on this master and PhD program are more discussion. We exchange, we supervising more this area. Not always talk. So this is my understanding to we say to deliver this kind of called face-to-face class or lecture. So later for my slides, you can see not so much possibly like the normal bachelor or diploma kind of course, lots of slides, lots of the theory talk, but mostly just highlight some, I believe, some about the unique area, whatever from Chinese medicine area or my personally understanding in Chinese medicine, in acupuncture. Such as you will know, for this afternoon, half day, or less than half day, 3 hours, and tomorrow all day, will be all delivered by myself. Although the lecture itself, the online courses was not delivered by me, for Huangdi Leijing, delivered by Dr. Mei Yu, and other courses by some different lecturers, but some reason, because some they can't came to here to deliver this course, but I will take this role to deliver these courses. So these two lectures are, in some respect, they are mixed. So today is, we say, the advanced pattern identification. Tomorrow is on Huangdi Leijing. For my understanding, these areas are quite similar, or quite possibly could be combined with each other. So possibly some areas we are delivering are a little bit mixed. So I will, during this 1.5 days, I will try to needing us as something like a presenter or need a tutor for our discussion in some areas. Not always my talk, because many of you has already 10 years, even 20 years personal experiences, or some of them has already involved lots of teaching, even our two doctors are already here. So it's not only my just talk, it's needing some interesting topic for discussion to share experiences. That's my understanding. So for this afternoon, there are, I personally suggest we start with two topics of discussion. The first one is, what's your understanding of TCM diagnosis? In bachelor degree or diploma, where you say, oh, TCM diagnosis is a judgment of the patient's pattern, use our 4 diagnosis methods, such as observation, listening, hearing, the palpitation, etc., etc. This is, we say, TCM diagnosis and diagnosis methods. But as a nowadays experienced practitioner or senior practitioner, nowadays based on your understanding, what is TCM diagnosis? What's the we say, differentiation? Any idea from you?
You could say this harmony, I look for this harmony between body and soul.
Body and soul. It's good. Yes, that's great. It's about the body and the soul. Anything else? Any different?
Well, I think what's important for me is that it takes everything into consideration.
Everything into consideration of the patient.
So it's physical, mental,
yes,
emotional.
physical, mental,
that
energy.
it's not just narrowed in on something. That you have to look at the complete. You have to look at the whole.
Yes.
And then
Look at the whole as a holistic.
Yes.
That's great.
Make a judgment from that.
Yes. Anything else?
So to understand the relationship,
Yes.
internally, your
Relationship.
relationship between your internal system and the relationship between you and outside of the world.
Mm.
So it's include like
Relationship.
holistic.
Okay. A holistic relationship.
Yeah.
Relationship between the externally and internally. Okay. Yes. Anything else?
And the TCM diagnosis, they have a lot of methods to do it.
A lot of methods to do
Yeah.
the TCM diagnosis.
So you can choose one or two to do the diagnosis.
Okay, you can choose one or two of the methods
Okay.
to practice your diagnosis.
Yes.
Is it? Okay. Anything else? Any your understanding about TCM diagnosis? Normally we will say the TCM diagnosis is blah blah blah. It's blah blah blah. So as you know, diagnosis, particularly for Western medicine, is a massive, unique, massive, important area. Without diagnosis, you can't do anything. From Western medicine perspective, when you start thinking of patient treatment or the intervention, without any, we say, diagnosis, how can you start any treatment? And also, sometimes we say the Western medicine, we sort of, sometimes we call it 会诊. It means the diagnosis together. We together a meeting to make a diagnosis before we deliver any treatment. This is the unique for Western medicine. But from Chinese medicine area, what's different or any unique area between Chinese, the Western medicine and the Chinese medicine? What's your understanding based on?
I wish I can diagnose this by the date of birth, and the time of the birth,
Yes.
and also by the observation
Yes.
to see the people outside
Mm.
and can just like X-ray to understand everything inside.
Okay.
So I wish.
Which, yeah. That's you. That's very good. You're a master. You're a master.
I actually think the diagnosis is the cornerstone, and it can be hard enough to get it right with complicated cases.
Yes.
Do you know?
Yes.
And you see people, because I do a little bit of teaching as well,
Yes.
and you see people missing
Yes.
basic signs, and I personally think, and that's the area where I have always tried to work to improve my practice,
Yes.
because the treatment is easy.
Good.
But the
As soon as you get the diagnosis.
diagnosis right, to
Yes.
get it absolutely
Absolutely.
correct.
Right.
That's the hard bit.
Good.
That, for me, that's what I find.
Great.
To get it perfect, that's the,
Great.
yeah,
Thank you for your contribution.
yeah.
Yes. About what's your understanding?
I think Chinese medicine is a tailor-made.
Tailor-made.
Tailor-made, so it's
Tailor-made.
individual,
Individual.
it's subjective. It's not.
Okay.
It's not.
Good point.
Yeah,
Good point.
it's but for individual. Therefore, our success rate, we can claim it's what 100 or 80 or 70 because we look at individual.
Individual. Good point. Yes, please.
Well, for me, it's also multifaceted. So I have a practice and I specialize exclusively in treating fertility.
Fertility. Okay.
Also. And so for me, diagnosing is three parts, right? It's what's their constitutional diagnosis.
Yes.
Where are they in their menstrual cycle? And
Yes.
then acutely, what's happening that particular week.
Mm.
So, and it's always changing. Their constitution
Yes.
may not be changing, but
Okay.
I have think about the TCM diagnosis has actually isolate our TCM practitioners that in our own group.
Yes.
Because the diagnostic, we can understand each other if we studied already.
Yes.
But if we are contacted with the Western medical doctors,
Yes.
and they will ask about the TCM or your diagnosis, there's lack of language to communicate. This is actually the shortage of the TCM diagnosis. I think in modern time we should change something, because if we say spring qi deficiency, or we should say okay, digestion part, or actually it can be changed a little bit.
Okay. That's a good point. Yes. As Dr. Ma, similar as some of our other Chinese, we say doctors. When we are training in China, you know, we train both Western medicine and Chinese medicine. And when we start our practice in both of which our practice in a hospital, when we start to treating patients, our diagnosis normally is bilingual. We should make our TCM diagnosis that this name of disease and as accurate as possible of Western diagnosis. Sometimes we can say this is possible of headache in Chinese medicine. When the Western medicine the diagnosis, the name of diagnosis for Western medicine aside could be high temperature, high blood pressure, high tension, or something else because of stroke or something like that. This is the same diagnosis name of TCM, but different English, the Western medicine diagnosis. This is your part. This is something else regarding for the communication between Chinese medicine and Western medicine. This is the interesting part.
But actually, it is, for example, spring's function, it's
Yes.
digestion's function,
Yes.
and we still, we are calling it spring.
Yes.
So, I mean, it's actually, in my mind,
Yes.
it's a little bit in very traditional way, they are mixed up or some
Yes.
organs function, but we still follow it.
Okay.
This
Great point. Your point, oh, yes, please.
Yes, I think it's not only for the doctors but also for the patients.